With some hospitals pushed to the brink, a number of retired nurses have stepped up to answer the call for help. But one in particular says she was forced to give up because the process was long and pricey.
There are many obstacles for a retired nurse like me to achieve reinstatement, and it just became so frustrating. I just gave up.
Julie Richardson was an ICU nurse in Toronto before retiring 5 years ago. When the call went out for retired nurses to help during the pandemic, she stepped up, hoping to support her colleagues.
I was told that if I hadn't practiced within 3 years that I didn't qualify for an emergency reinstatement of my license. I think it's ridiculous because after 40 years of honing my craft, I certainly didn't forget how to do my job.
The College of Nurses of Ontario says there are 8 registration requirements applicants must complete, adding, quote, CNO has identified reinstatement as one of our priority areas of focus in registration at this time. We're currently reviewing our reinstatement applications and our registration process to see how we can support nurses who wish to reinstate their registrations and enter the workforce in the healthcare system.
A pandemic is not the norm, and the rules should be shifted or changed to accommodate nurses like me.
The Ontario Nurses Association has called for the Ford government to work with the regulatory body in helping to bring back retired nurses.
They've been out of the profession for 2 or 3 years and 5 years. They still have value-added skills that would be helpful in our workplaces and be supported. They certainly don't lack for knowledge and for experience.
The ONA adds that it's concerned that some nurses are retiring too early. The association says in a survey from last summer, of the 620 members who recently left the profession, 49% were under the age of 40.
It just cannot withstand that loss of those mid-career nurses. But bringing back the retired nurses, they may not have left if other common themes weren't happening.
ONA says things brought forward by a staffing shortage saw nurses face long hours, heavier workloads, and not feeling valued, adding that bringing back retired nurses will help the current workforce.
Retired nurses that have decided to leave earlier than they had anticipated would be enticed to come back if they had been treated more respectfully, if they had an incentive to stay.
And CityNews also reached out to the province asking if expediting the process for retired nurses was an option the government was currently considering. However, a spokesperson did not respond in time for broadcast. In Toronto, I'm Faiza Amin for CityNews.